My name is Blair Bertaccini. I've lived in Waterbury since 1992, but my connection with the city goes way back when I was a teenager, and I used to work in a factory here up on the corner of Homer and Thomaston Avenue. It was the Boise Cascade plant. No, I mean, the building's there, the company isn't there anymore, where my father also worked. So on behalf of Community United for Jobs, Healthcare, and Opportunity, I want to welcome you all to this community forum. Community United has already knocked on hundreds of doors in our neighborhoods to survey people's healthcare needs and find out what their priorities are. Over 300 people have joined our group by pledging to fight for good jobs and good healthcare in Waterbury, and more are joining every day. Many of us reacted with hope and optimism this spring when it was announced that St. Mary's Hospital and then Waterbury Hospital were joining with LHP Hospital Group to build a new facility in our city. Waterbury deserves a first-class hospital, and we appreciate anyone who is here to help us achieve that. But after the announcements and the dust sort of settled, the questions began to arise. Will the hospital be built in Waterbury or outside of Waterbury somewhere? Will healthcare increase or decrease for our residents? How will only one emergency room meet our needs? How will a 50% reduction in hospital beds accommodate people in need? And where we had two nonprofit hospitals serving the city for over a century, now we're going to have one for-profit hospital. How will this affect community benefits commitment that the nonprofits are required to provide? But a profit-making institution is not. How can there be a community benefits plan at all if LHP does not talk to the community? And what about jobs? Waterbury has, actually it has the highest unemployment rate of any survey area in Connecticut. We sometimes go back and forth with the Willimantic area, but I think currently we have the highest, and it's above the national average. Can we afford to have thousands more families without an income? Will construction jobs benefit both the building trades workers, whose unemployment is also very high, and the residents of the city? The answer is, at the moment, we don't know. And until we can meet face-to-face with all the decision makers, especially LHP Hospital Group, which will control this new hospital with 80% ownership, we will not know. We want to hear what your concerns are tonight, and we will add them to the list we have been compiling. We will then send them to LHP and request a face-to-face meeting in the very near future. We will want written commitments, not press releases or vague promises, on the critical issues we are raising tonight. So I hope you all agree that we should take our concerns to LHP and get real commitments for jobs and health care. So let's begin, and I'm going to turn the microphone back to Steve.